All right, a few new studies about COVID and how it is the gift that keeps on kicking us all in the butt. First,
now COVID or the vaccines?
Well, both, actually, because we're going to talk about what lockdowns did to children. We're going to talk about what the vaccines continue to do to young men, particularly, and this about what the vaccines may have done to young women in their reproductive years. A study from Germany's Federal Institute for Population Research shows a, quote, strong association between the onset of vaccination programs and the fertility decline 9 months after. So researchers are saying that fertility in Germany, and they are able to link this to Sweden as well, but for different, there's some different data points there. So we're going to focus on Germany, that fertility is down 10%, and they are unable to link this to other factors such as changes in unemployment, infection rates, or COVID-19 deaths. They are finding a strong association between the onset of the vaccination program and fertility decline 9 months later. So here is a chart that shows fertility rates in Germany steadily increasing through 2017, and then it starts to plateau a little. But then if you look at the years between 2021 and then recently in 2022, there's a precipitous drop. And they mention, and then we're going to see exactly when vaccinations were administered, mostly in Germany. The next chart shows monthly adjusted fertility rates in Sweden. Again, same precipitous drop right after those vaccine programs were rolled out. So if you look at the change, that's the next chart I'm going to show you, the change year to year, 2021 to 2022 of live births, the number here, if you specifically look at the last column for the birth rates that we have in early 2022, the column on your far right shows decline of 8%, 10%, 10%, 11%. And then it does seem to be declining. So there's some questions here. Again, the same can be said in Sweden. If we look at the column on the far right, it starts to decline 6%, 4%, 7%, and then it peaks at 12%. Which, again, if we start to think about vaccines in these countries were really rolled out around May or June of 2021, and then we count forward 9 months, then we see those peaks in infertility. So that's interesting. Now let's compare that again with when the vaccines were administered in Germany. That tracks May or June of 2021. See the peak of these vaccinations, first dose, second dose. So when you count, I know those of us who have had babies, it's annoying when people say 9 months because it's really 10 months. It's 40 weeks, but you kind of get the first month off. But nevertheless, we're going to go with this.
Yeah, you birthing people.
Don't call us birthing people. So then again, 9 months later, fewer babies. Now, we have spoken many times about how the vaccine is associated with altered periods. And again, without regular ovulation, it is much harder to get a baby. But what about the babies that were conceived? So this is interesting because data from a Freedom of Information request from Professor Christoph Kubanter shows that stillbirths are also increasing, actually.
Look at that. Holy smokes.
In this period of 9 months post-vaccination. So these are people who presumably got the vaccine early into mid 2021 and either already were pregnant or about to get pregnant and then had this awful result from their pregnancy. So there are questions here that are lingering, like, will it sort of level out? It does seem that these birth rates are coming back up and the stillbirths are declining. So is this a result of, is this associated with first and second dose and then it will not continue? It was a sort of a short-term phenomenon in disruption of reproduction and then maybe coming back because your body recovers. That would be a hopeful interpretation
that
of these numbers.
Yeah, that would be good
We
news.
just don't know. All we know right now is a correlation. We don't know a causation. So that's interesting and definitely worth taking a look at when you juxtapose it with the fact that doctors are now admitting that there was an alteration in menstruation cycles.
So, well, interesting. So someone says, isn't falsifying medical records illegal?
What does that have to do with this segment?
I don't know if they meant like I think they're thinking the alteration. They might have misheard alteration, like alteration of your body. That's not someone altering records, though.
I don't think I said anything about altering records.
Okay. Just making sure.
Okay.
No one's falsifying medical. In this study, I don't think so. Right? Or according to this data, I don't think so. Are you listening? I am listening. I'm just listening to what the chat was saying.
Nonsensical chats. Okay. Thank you for that. Let's move on to a different study. A new study in the Journal of American College of Cardiology shows that the risk of myocarditis was higher for people who received the Moderna vaccine than it was for the people who received the Pfizer vaccine. They're still saying that it's a relatively small risk, but they are at least admitting that this is verifiable. And again, if you take a look at their results, it shows that males younger than 40 who received the Moderna vaccine were shown to have the highest rates of myocarditis, which according to authors may have implications for choosing specific vaccines for certain populations. Again, they're admitting that it's mostly for young men. Okay. And another study I thought worth flagging for you all is not to do with vaccinations. It's to do with what happened to children during lockdowns, because JAMA Pediatric shows that screen time for children is up 52% since the pandemic. That's an additional 84 minutes per day per child. I can only read this as what I am, and I am a mother who constantly tries to keep their kids off of screens, and this makes me so mad when you think of doing this to children on purpose, because it says that this change was harshest for children between the ages of 12 and 18, and this is habit forming. These are habits that they are going to have to either learn to break or will keep with them. We can all unequivocally agree that 52% more screen time is not good for children. But what else did they have? School was online. Their friends were online. How can we collectively put that horse back in the barn?
I don't know. I mean, we just got to throw it out the window or something. Because I would think about when I was growing up, I mean, I would sit and play guitar. I'd be in my room listening to music and playing guitar as much as I could, or just drawing, reading books. And I feel like there's just this propensity now to just reach for that screen, I mean, and, it's just such an addiction now. And we know things like TikTok are just absolutely mind control. But
it is now correlated with much less healthy habits for children. They get less exercise. They have more disruptive sleep. They have more anxiety. They have, less. Like some friends we were talking about raising our adolescents, and we're like, they don't seem to really care about being together as much. If they can be home, be in their room and chat with people however they want on WhatsApp or whatever, then they don't have the same, like, let's meet at the mall, let's meet up. They don't have the same need to see each other outside of school, which is interesting. But they're beyond just like sort of social isolation. There are real health consequences to keeping kids on screens.
Right.
I was going to say too, like, think of just the lack of vitamin D that they get because they're indoors all the time. Like, vitamin D is a powerful vitamin, right? And it's like, we used to be outside all the time and we had plenty of vitamin D, because in Portland, they tell you during the winter when it's rainy and gloomy, make sure you take vitamin D as a supplement, because people get depression. So it's like, maybe these kids are dealing with a lot of this stuff because they're in incandescent or, LED lights all the time. They're not getting any sun. They're not getting any vitamins.
Yeah.
Oh, for sure. And they're just in there. I mean, they're sallow. They're hunched over. We had a story in the newsletter the other day about the future of humanity.
Right.
That story troubled the hell out of me. It shows like, is the human body now evolving to be like this, like hunched over, holding of a cell phone creature, like
with a second eyelid to screen out the blue light.
I got my phone. I'm like a hunchback here. Like this will be the future of humanity, instead of like strong, I'm not going to be but like, strong caveman stuff, whatever. I'm going out hunting today. I'm going to bring back a deer for my woman.
Yeah.
So she can eat.
Sure.
You're my woman.
I don't want a deer.
But instead I'm going to be like, I'm just hanging out on TikTok all day and I've got this. Now I don't do anything. And by the way, I don't eat meat anymore because they just want me to stay inside. Right. They want to control what I do. And they want to keep, me eating like Beyond Meat burgers.
I mean, it's a Herculean effort now to keep kids, to like encourage them to come off their screens when they had nothing else.
Yeah.
Go ahead, David.
Well, and have you ever watched kids text, like how fast their fingers are? Like I can't even think that fast. And I'm sitting there watching. That's the evolution of finger dexterity because these kids are just like.
Yeah, I never thought of that.
My littlest one.
How do you do that?
My littlest one. My medium girl. My
medium,
middle, whatever. The one
you got large, medium, and small.
Yeah, I do. She, even a few years ago, because she grew up with like the touchscreen environment, she was like able to fire off a text like, "Daddy, where are you? Daddy, are you home? Where are you, Daddy? I was asking a question. Can you buy this app for me? Can you?" I'm like, "How are you typing that fast? Like, do you have this on speed dial?"
But they do a lot of dictation too.
Oh, right.
And
I was
our
going to say that's
one,
my daughter. My daughter does text or speech to text. That's how she texts. So she doesn't actually like take the time to put in each letter. She just talks to it.
Yeah. So that's cheating. No, it's not.
So that's that.
I think it is.
So that's a roundup of all the ways the pandemic is.
It's not even a pandemic. It's
COVID.
There's no it's. Well, all right.
What do you want me to call it?
I don't know. I want to call. I just this. I don't know what we can say here that we won't get deplatformed for saying, but. All of the biopharmaceutical complex that wants us to do this, wants us to stay indoors, wants us to be off the roads. Literally, read their plan. They want us to not even working in cities anymore. They want the reduction of them. So of course they want us to stay home.
Well, this also tracks with the story you did in the beginning of the show about how global powers are not interested in birth rates.
Right.
For them, that's fine. That chart is totally fine.
Oh, it's great. Oh, you mean we're declining births? Wonderful. That falls right into what Bill Gates wants.
Yeah.
That's exactly what they want.